Okay, guys, so very quickly, the lymph and the immune systems. This one is going to be just about the lymphatic system. I'm not going to talk too much about immune. I found another PowerPoint that I think makes it a lot easier to understand. So for here, it's going to be, I hope, a kind of quick one, talking about your lymphatic system. Your lymphatic system consists of a bunch of lymph vessels, the lymph, which is the fluid within the vessels, the lymphatic tissue, and the lymphatic organs. The lymph vessels, a lot like your blood vessels, pretty much are all over your body. The biggest difference between lymph vessels and blood vessels is in the lymph vessels, the fluid only goes one way. There's no back and forth and back and forth. It only carries fluid from the tissues away back towards the core of your body. The tissues and organs of the lymph system are the lymph nodes, the thymus, the tonsils, the spleen, and the red bone marrow. We're going to talk more about those a little later. The system does a couple of pretty important things. One is maintenance of fluid balance. Fluid continually seeps out of the capillaries into the surrounding tissues. The capillaries reabsorb about 85% of that fluid and leaves about 15% of it behind. Over the course of a day, that remaining fluid would be as much as probably 4 liters of fluid, enough to cause massive swelling. And if you can imagine having 4 liters of fluid in the tissues of your body, that could be pretty dangerous. It could even lead to death. One of the roles the lymph system does is to absorb that fluid and return it back to the bloodstream. There are specialized lymph vessels in the small intestines that absorb fats and fat-soluble vitamins. And then the lymph nodes and other lymph organs filter the lymph, that fluid that's inside your vessels, to get rid of microorganisms and foreign particles. Lymph vessels are a lot thinner than blood vessels. They have valves, and we've learned before valves are there to help prevent backflow. They're formed of a very thin layer of epithelial cells. Unlike the cells in veins that are tightly joined, the cells in the lymph vessels overlap loosely. This allows gaps between the cells so fluid can get in easier. There are protein filaments that anchor these lymph vessels to surrounding cells, and that is what prevents them from collapsing. Lymph vessels originate in tissue spaces as microscopic, blind-ended sacs within a bed of blood capillaries. The fluid that's left behind after the capillaries reabsorb, that 15%, flows into the vessels between the gaps between the cells that I just talked about. Bacteria, lymphocytes, and other cells also flow in with that fluid. These vessels converge to form larger and larger vessels, and periodically they empty into lymph nodes, where immune cells phagocytize the bacteria. Remember, phagocytize means they engulf and destroy and eat up, break down, whatever word you want to put to it. They destroy that bacteria. The vessels then continue to merge, eventually forming even larger lymphatic trunks, which drain major regions of the body. These trunks converge to form 2 collecting ducts. One of them is near the right subclavian vein, and one is near the left subclavian vein. The lymph then joins the bloodstream when the collecting ducts merge into the subclavian veins. The fluid moves passively. Really, the thing that helps the fluid move is the rhythmic contractions of the lymph vessels. This is also helped along by contraction of skeletal muscles, and respiration causes pressure changes that help move the lymph from the abdomen to the thoracic cavity. The 2 collecting ducts I just talked about, the right lymphatic duct drains the lymph from the upper right quadrant of the body into the right subclavian vein, and the thoracic duct, which originates in the abdomen, drains lymph from the rest of the body into the left subclavian vein. It's not exactly divided equally, obviously, but it seems to work for some reason. The lymph organs: red bone marrow, thymus, lymph nodes, tonsils, and spleen. Some places also include the appendix in there. The red bone marrow and the thymus are the primary lymph organs. They provide the spot for B and T lymphocytes to mature. Lymph nodes, tonsils, and spleen are the secondary lymph organs. They contain the lymphocytes that have matured in the red bone marrow or the thymus. There are patches of special tissue containing lymphocytes scattered around the body. And some of the passages that open to the outside of the body, like the respiratory tract, the digestive tract, contain a scattering of lymphocytes in their mucosal linings. Lymph tissue exists in masses called lymphatic nodules, like the Peyer's patches. Those are lymphatic nodules in the small intestines. Those obviously are the ones that help with fat absorption. The thymus. Remember when we did the endocrine system, we learned the thymus is there in childhood, but at around age 14, it starts to shrink, and by the time you're an adult, it's really just kind of a mass of fatty tissue. The thymus is divided into lobules that extend inward from the outer capsule, and each lobule consists of a dense outer cortex and a less dense medulla filled with T lymphocytes. So the immature T lymphocytes travel from the red bone marrow to the outer cortex of the thymus. Once they get there, inside the thymus, they're protected from antigens in the blood, giving them a chance to divide and mature. The developing T lymphocytes then migrate toward the inner medulla, and as they do, they encounter other lymph cells. And this process helps to train these new lymphocytes so they can tell the difference between the body cells and the foreign cells or the invading cells. Once they've completed their training, I was going to say it takes maybe 10 months, but I'm not really sure how long it takes. Once the training is complete, the lymphocytes are released into the bloodstream. The body contains hundreds of lymph nodes. They're kind of shaped like a bean, almost kind of look like the kidney, don't they? Some nodes are tiny, only about 1/4 of an inch long. Others are more than an inch long. Lymph passes through these lymph nodes, and as it does that, it slows down to a trickle. That way, the lymph node has time to remove the pathogens and other foreign materials. Lymph nodes also serve as the final site of maturation for some types of lymphocytes and monocytes. There is a capsule that encloses each lymph node. It's a fibrous tissue. And then connective tissue called trabeculi extend into the node, dividing it into compartments. These compartments are called cortical nodules, and these are filled with lymphocytes. There is a less dense area at the center of these compartments. This area forms and releases lymphocytes when an infection is present. Sinuses lined with macrophages are capable of phagocytosis. These sinuses separate the compartments. Lymph slowly flows through these sinuses in the process of being filtered. Several afferent lymph vessels channel fluid into a node, just like the afferent artery channels blood into the glomerulus of the kidney. And then after it's filtered, lymph leaves through a single efferent lymphatic vessel, just like the efferent artery takes the blood away from the kidney. At least they didn't come up with different words for you to have to learn for that. The tonsils, we're all familiar, I think, with the tonsils in the back of our throats. These are masses of lymphoid tissue. They form a circle at the back of the throat where they help to guard against pathogens entering the body through the nose or the throat. There's actually 3 sets of tonsils. There's a single pharyngeal tonsil. It's also called the adenoids. It sits on the wall of the pharynx just behind the nasal cavity. There's a pair of palatine tonsils in the posterior of the oral cavity. And then there's numerous lingual tonsils. They're concentrated in patches on each side of the base of the tongue. The palatine tonsils are the largest. They're the ones most prone to becoming infected. Those are the ones, if you have a tonsillectomy, those are the ones they're taking out. If you have a TNA, they call it, tonsillectomy and adenoidectomy, that's the tonsils and the pharyngeal tonsils that are being removed. We have the spleen. The spleen is about the size of a fist. It's the body's largest lymph organ. Just like lymph nodes, it's surrounded by a fibrous capsule, and it has inward extensions of the capsule that divide the spleen into compartments. There are actually 2 types of tissue in your spleen. The white pulp contains compact masses of lymphocytes. It surrounds the arteries leading into each compartment. And then the red pulp consists of a network of erythrocyte-filled sinuses. These are supported by a framework of reticular fibers and phagocytic cells. Blood collects in these sinuses after passing through the fibers and then returns to the heart through the veins. The spleen has a couple of different functions. We may have talked about these when we talked about one of the other body systems. The spleen's function and immunity, which is what we're really concerned with this week. Lymphocytes and macrophages in the white pulp screen passing blood for foreign antigens. And phagocytic cells in the sinuses will ingest and destroy microorganisms. The spleen also destroys old red blood cells, and remember we learned red blood cells last about 120 days. Macrophages in the sinuses remove and digest these worn out red blood cells, and they also take care of imperfect platelets. The macrophages also, as they digest the worn out red blood cells, they'll take the hemoglobin and recycle it, returning the iron and the globin to the bone marrow and liver for later use. The spleen stores about 20% to 30% of the body's platelets, and in the fetus, the spleen produces red blood cells. So we've looked at the lymphatic system really quickly. It's not a huge system, but it does have a pretty important function when it comes to immunity. And then next we're going to be looking at the immune system itself.